Hi,
happen.
everyone. My name is Brinley Brooks. I am the founder and executive director of HS Connect and the Patient Advocacy Coalition, which you'll learn more about later because we're just in the process of getting all of our ducks in a row and becoming official. But it's a group of all of the HS patient advocacy groups that have formed a coalition behind the scenes to work to raise all of the voices of our organizations together. So we are all hosting this as a joint session. So we are here with Dr. Roth today to talk about misconceptions about HS, which most of us have encountered at least once, if not multiple times. So I'm going to turn it over to Dr. Roth and let her do her thing and take us through all of this. So thank you so much, Dr. Roth, for being here. I appreciate it.
Absolutely. I'm very excited to be here. And thanks everyone if this is your second time around due to our slight technical difficulties last week. But I'm really excited to be here. Sorry, Brinley, I did not warn you. My last name is Roth, but you can also
Oh,
call me
okay.
Gretchen. Nope, it's not, it is absolutely not self-explanatory. Would never guess it if it were not the name my parents had given me. So but I'm Gretchen Roth. I'm a dermatologist. I practice in Milwaukee, Wisconsin. I'm out of the Medical College of Wisconsin, which is medical school and academic center in Milwaukee. I see only adult patients, but I do all derm. I see kind of gen derm, but I do run an HS specialty clinic over the last couple of years with one of our PAs, which has been a blast and such a pleasure to meet so many awesome people with HS and do my small part in trying to help people feel better. So this is sort of adapted from and similar to a talk that I gave with Dr. Dave Louie that some of you might know as well, but I've added some things and hopefully we have plenty of time at the end of the talk. I'm happy to answer questions and would love to hear some of the myths that you guys have heard so we can share them with more people. So, nope, there we go. So I did borrow this slide from Dr. Dave Louie, which I think is fantastic because basically the idea is these myths sort of come from somewhere and often there's a little kernel of truth hidden in them. But there's a lot else that comes into where these myths come from. So, the hope that people have, our own personal feelings from people around us, why we care, why we're impacted, and all of these things go into creating these myths. So our goal today is to talk through some of these myths, talk through the little nuggets of truth that may be in them, but then talk about sort of what the reality is. So we'll start with the first one, which is that HS is rare. So again, these are myths. These are not true. And we get told this all the time. And honestly, you might think that this is true based on how long it can take to get diagnosed with HS, how many, docs and PAs and NPs that you run across in your life who have never heard of it. And there is a little truth because it's not often openly talked about. So because of a lot of the areas that HS involves and just sort of the personal nature and some of the things that come with it, a lot of people that have HS don't openly talk about it. And then I guess the other big issue is that clearly we're not teaching enough about this in medical school, PA school, NP school, because there are still tons of people that don't know about it. But in reality, probably about 1% of the population has HS. So that's actually a huge number of people. 1 out of every 100 people that you meet it potentially has HS, which is a lot more than what we think. And I did some silly math and turns out the average Taylor Swift Eras concert has about 72,000 attendees. And that means that there's over 700 people per Taylor Swift concert that potentially have HS. Okay. The second myth is a common one, and this is sort of a broad myth, and that's that HS only affects certain groups of people. And you hear all sorts of things. So HS only affects women. HS only affects people who are obese. HS only affects smokers. And the other one that we hear a lot is that HS affects people who aren't clean, who don't have good hygiene. And we know that none of these are true, but there is a little kernel of truth in some of them. And a lot of that is just that there are certain groups of people who are more likely to have HS. So certainly we see more women than men with HS. It can be worse in some people who are overweight, in some smokers. but definitely not directly related. And then the other thing is that, again, because a lot of healthcare professionals don't fully understand HS, these myths can sort of get spread by the people that are supposed to be taking care of you. So the reality is that HS can affect absolutely anyone. It tends not to start till puberty, so it's uncommon to see it in really, really young kids, but early puberty is actually becoming a bigger issue. And so sometimes we do see relatively young kids that have HS, but it can affect anyone from young to elderly, men, women. And then the cause isn't fully known. So we don't really understand why things like obesity, smoking can affect this, but we do know that they're not the underlying cause. We absolutely know that HS is not caused by poor hygiene, and that's just a terrible myth that sometimes still spreads around. And we know that HS is not your fault. There's a lot of reasons that people get it, and we can go into some of those a little bit, but there's a lot about genetics, things potentially that we're eating, things that we're doing, but a lot of it is genetics and just our immune system and how our immune system responds to things happening in our body. So shame and blame are harmful. They make people not want to see providers. They make people not want to talk to other people about their HS. And so it's really important not to spread these myths. And I realize I'm preaching to the choir here, but I still love sharing this information. Another one we see a lot, maybe a little bit related to the last, which is that HS is an infection. If it happens in the groin, sometimes people are told they might have a sexually transmitted infection. People are worried that it's contagious, or sometimes you might be told it's contagious, and it is none of these things. So the truth here is that the inflammation in HS actually can look a lot like an infection. So one big angry HS abscess can look just like an infection, but it usually isn't. And then it's also not to say that people with HS can't get skin infections. Certainly you can, but that's not usually the main issue going on. We also know that bacteria can play a role, which sort of helps perpetuate this myth. The normal bacteria that live on our body and live inside our HS lesions can make the inflammation worse. And then the really tricky thing is that antibiotics can actually help a lot of people with HS. And there's a lot of reasons for that, probably helping with inflammation, helping with some of those normal bacteria that are causing more inflammation. But when people get antibiotics and feel better, it can sort of perpetuate that myth that this is all an infection. So in reality, HS, not contagious. You can't spread it to yourself. You can't spread it to others. And in fact, we know that calming down or blocking parts of the immune system can actually help treat it. And that would not be true with an infection. An infection, you need your immune system there to help. But lots of things go into it. So genetics kind of runs in families, hormones, and our overactive immune system all play a role, but in general, not an infection. Okay, you cannot spread HS. This is important. Okay, the other one that's still around a lot is that HS is a sweat gland disease. And this is, I think there's a lot of reasons for thinking this, and some of it is maybe that people that aren't dermatologists don't understand the difference between sweat glands and hair follicles, but it's a thing. So the truth is that we've actually thought this for a really long time because HS tends to occur in areas that have a lot of this particular type of sweat gland called apocrine glands. So armpits, groin are really common areas. And so that's part of the reason we thought that. There's still a lot of surgeons that will tell patients that when they're having HS surgery, they're removing their sweat glands. So again, there's still a lot of reasons that this one gets spread. But it actually turns out that HS has not much to do with the actual sweat glands at all. It has to do with a different structure in the skin called the hair follicle, which is where our hairs grow out of our skin. And that's actually super, super important because it means that you can get HS anywhere on your body that hair can grow, which is basically anywhere on your body except your palms and soles. So although the areas with those particular sweat glands are more common, they're not the only area you can get HS. And we also know that treating hair follicles with things like laser hair removal can help. So laser hair removal that has nothing to do with sweat glands can actually help calm down HS as well. And like I said before, there's a ton that goes into it. So for some reason in HS, hair follicles get plugged when they shouldn't. But beyond that, there's this whole huge immune system problem where the immune system is like attacking this little plugged hair follicle and just going completely haywire. So HS can happen anywhere on the body. And I've seen it weird places like the front of the knees or, anywhere. So another myth is that there's no treatments for HS. And I think this can be a little confusing because there certainly is not a cure for HS, but that doesn't mean that there's nothing that we can do for it. Or I also call this the getting told when it gets really bad, just have surgery and there's nothing else to do, which is clearly not true either. So tiny bit of truth here, there weren't even any FDA approved treatments until 2015. And the truth is that there isn't a perfect treatment. There's no sort of silver bullet for everybody, and it's really hard to treat. So a lot of people will try multiple treatments that may work for one person, but don't work for you. And it can kind of feel like there's nothing that helps. But we have come a long way. So there's actually 2 FDA approved medications now for HS. But if you look through guidelines that are written by dermatologists, there's over 30 different medications that are recommended for potential use, 10 different surgical procedures. And the really exciting thing is there's a lot of interest in figuring out how to treat this disease better. And interest is important and money is important. There's a lot of companies that seem more interested and are actually putting their money kind of where their mouth is. So lots of people doing research, lots of new drugs being studied that weren't before, which is amazing. So lots of treatment options and lots down the road. So this brings me to my next myth, which is this worked for me, it'll work for you. And my favorite version or least favorite version of this myth is when someone says that something doesn't work for them, so it won't work for you. And both of these can be a little dangerous. So like I said on our last slide, there's a little truth to this. Medications work in some people and they don't work in others. We are all unique individuals and side effects, how well things work is different in everyone. But that also means that if something worked for someone else, it may not be, again, the silver bullet for you. But really importantly, it means if someone who has HS tried something and had a side effect or it didn't work, that does not necessarily mean that you would get that same side effect or have, or that it wouldn't work for you. So I think people have good intention. They want to share when things work well, but it can lead to disappointment. And the other thing I've seen is it'll lead to people who really are like, nope, I don't want to try that because I know someone who had this issue. And, a full disclosure, all medications have potential side effects. No one should ever tell you that that's not true, but it does mean that you need to sort of think through the risks and benefits for yourself with the person who's helping. So we are all unique. Everyone's different. Everyone's HS responds a little bit differently, and we all sort of respond to medications differently. All right. I wish this one were true. The right diet will cure my HS. Probably, I don't want to say a little truth to this. We know that diet is important. We know that diet can contribute a lot to inflammation. We know that there's probably all sorts of weird stuff going on with our microbiome and gut bacteria and inflammation. And we know that there's some particular things that can cause flares in some people. So dairy certainly can cause trouble in some people. Brewer's yeast can cause problems in some. And I live in Milwaukee, the land of like beer and bread, which is a big problem. So but in reality, diet, it may help, but it rarely fully fixes the problem. And then the really disappointing thing is it may make no difference at all. I've had patients who've tried some of these things. They've tried really strict anti-inflammatory diets. They've tried cutting certain things out. And it doesn't always help. And I think that can be really hard for people because when you are trying really hard to do something and things don't get better, sometimes there's a lot of self-blame. Like, why can't I fix this problem with what I'm eating? What am I doing wrong? And I think that's important to sort of think about, because self-blame is not helpful in a condition that you have such little control over. So eating healthy is important, not saying it's not, but it might not fix your HS. And the other thing here is I think there's a lot more to come. There's some people doing much better research now than we've done in diet before, and we may be able to find a lot more information about, what triggers things in who, but we're unfortunately not there yet. And the one little aside I didn't put here is that you have to be really careful with this. When you're starting to do elimination diets and things like that on your own, some people get into sort of a spiral, and you actually can end up with like disordered eating, which is not a safe place to be. So you need to feed your body and be healthy. And if these are the kind of things you want to do, I definitely recommend doing them with the help of, dietitian, nutrition, your physician or PA or NP. Cool. This leads us to the next one, sort of related to some of the others, which is there's one perfect treatment for me. And I also wish that were true. And some people are very lucky and it is true for them. But the vast majority of people will need some sort of combination of treatments. And the way I explain that when I'm talking to patients is that this condition is caused by kind of a combination of different things. There's hormones, there's inflammation, there's plugged follicles, and often we need to address those with different medications. So it's good to have hope, but it can also hurt if you try one thing and it doesn't work for you. So I, say it's all about expectations. We don't have any, again, I've used the word silver bullet many times. We don't have any like one treatment that just works perfectly for everyone. And sometimes it means you have to go back and add things that you've tried before that maybe didn't work great on their own, but might work in combination. But stay tuned, be hopeful, because new treatments are coming down the road. And I think every time I hear talks about things that are in clinical trials, it seems like results are even better than what we have. And so we're really hopeful that down the road we will, maybe this one will be true. So combination treatments for most people for best results. All right, surgery is the only treatment. I know you guys know this one isn't true. And I also hear other people then want to avoid surgery altogether. So I like to consider surgery as part of the treatment and one of many options. But keep in mind that if you're seeing a surgeon, they do surgery. It's literally their job. It's what they're trained to do. And that may be what you're told by them, especially if they're not up to date on all of the advances within the treatment of HS. So surgery can definitely help, especially in certain situations, certain locations, but it's usually best combined with medical therapy. And if you have someone that's telling you surgery is your only option, get a different opinion, see what they have to say. And then keep in mind that not all surgery is the same. So if you are lucky to live near a surgeon who sees a lot of HS, there's sort of advances in techniques and how things are done. And sometimes if you've had surgery before and it wasn't super successful, it may be, the technique that was done, the fact that you weren't on other medications at the time. And so sometimes you may need to find a different person who just understands more about what you're dealing with and how to do surgery on it. Sorry, I went backwards. So just one of many tools in the toolbox. And then I can't remember, this may be my last one. I talked fast. No one understands my HS struggles. And I, again, am totally preaching to the choir here, because you're literally here at a talk put on by all the amazing patient support groups that exist with HS. And it might be true. You may not know anyone personally with HS, and HS can be hidden. Not everyone wants to talk about it, and a lot of people don't know what it is. But the reality, as I hope you all know, is you are not alone. We have amazing support groups, virtually, in person. We know, I say we as in people who care for people with HS, that HS has a huge impact on your quality of life. And if you're seeing someone who doesn't understand that, then as annoying as it is, hopefully you can use it as a moment to teach them how big of an impact it has. So it's really important to make connections with other people that really understand what you're going through. And sometimes if you're in the middle of a flare or a situation where, you know, the new treatment you're trying isn't working, it may just be someone to commiserate with, and that's really important. So you absolutely are not alone. And I did talk really fast because I finished in faster than 30 minutes. But I would love to hear about other myths you guys have heard, things that are going around so that we can make sure that we spread the word. I'm work on on a committee with the HS Foundation, and truly our goal with our committee is to sort of help educate everybody. So other docs, dermatologists, non-dermatologist patients, the public, everyone. And so these are important things for us to know. Obviously can't offer specific medical advice, which I'm sure you guys know, but happy to sort of speak broadly, answer any questions, or would love to just hear what you guys have to say.
Donna had a question. She
Yes.
was asking about HS and sepsis. She said, as you mentioned, HS is not a chronic infectious skin condition. However, it is a life-threatening infection in the bloodstream when bacteria enters, the bloodstream. Is there a percentage of people who experience sepsis?
Ooh, that is a really good question. And I don't have a specific number for that. And I think this is sort of a complicated one because having bad HS and having, you know, open wounds, things like that, it does certainly put you at a higher risk of getting a skin infection. So like something called cellulitis, and cellulitis can turn into sepsis. But I don't have exact numbers on whether it's like more or less common. One thing I will say that you have to think about though is that some of the medications that we're using now, because they do have an effect on the immune system, may impact that as well. So if you're on medications that suppress your immune system, it's certainly nothing to play around with. If you feel like something's infected, if you feel like, and it might be from your skin, but it could be sepsis from anything, pneumonia, to make sure that you're seeking care if you're sick. So yeah, I would have to look. I'm not sure if anyone's done specific research on sepsis and HS.
And then can you talk a little bit more about that? Because I think, you know, like you had mentioned, one of the common misconceptions that we hear is like that we must have an infection, A, because antibiotics are used to treat HS in some cases, and B, because what looks like an infection to anyone else who doesn't have HS is normal for HS. So can you talk a little bit more about like secondary infections and how that comes about?
Yes, that is a good word for it. So, and I will be totally honest, this is a struggle even for us, because the other tricky thing, before I answer your question, I'm going to make it even more complicated, is that when you are having an HS flare, you can have a lot of the signs and symptoms of having an infection, right? You have a lot of inflammation in the body. Your heart rate might be elevated. You might feel crummy. So when I see things that I worry about being infected, often it's something that looks a little bit different than your traditional HS. And I guess what I often see is like having a bad HS flare, and then suddenly like down your arm, you have a big, firm red, you know, area that may not usually be involved in HS that's spreading. Suddenly you're having fevers, you're feeling more crummy than usual. And that's a sign of like what we call a secondary cellulitis. And cellulitis is just skin infection. Anyone can get it, including someone with HS. So it's often sort of a little bit different. It may not be, you know, if you're flaring in armpits and groin all at once, probably not. But if suddenly down your thigh, you have this firm, red, angry area that's spreading and you're feeling crummier than usual, that's time to start thinking about this sort of secondary infection. It's
And
not super common. I don't see it a lot, but it can happen to someone with HS just like it can happen to someone without HS. So
And
hello.
oh, sorry,
And
go ahead.
and I'm recovering. I just had surgery on the 3rd. I have HS also, and I was going to have a breast reduction because my HS had gotten so bad. But when I was about to have have the surgery, my wounds were still open, so he couldn't even do the breast reduction because he was scared I was going to lose my nipples due to how bad it got. So I had to have, so he got in to get the all the infection out and go in and get the, as they call it, the core out. So I had to get it in my breast, on the side, in my groin area, and it's just been hard. Like the just the the recovery just has just been horrible, and I've been dealing, and I'm 36 and I've been dealing with this since I've been 18, and I've have tried Humira, and I was on there for about 4 or 5 years, and last summer around July I got a real infection, a real bad one in my left breast, and come to find out it had suppressed my immune system, so I couldn't take it anymore. So it's like we're down to I don't know what to take. So it's like I've just been dealing with it, and it's just horrible. And then, like you said, and so when you get that, when you get a boil or whatever, like you said, you get like a rash or something, and you're like, like you said, you start feeling crummy, you get a headache, and you have a fever, and it's so awful. So I was like, it's just like, it's like I said, I had never heard of it. Like I said, it's in my family, but I'm the one, like, I just have been suffering with it so for so long, like, missing work, and, like, people don't understand. Like, this is something to deal with.
Yeah,
Gosh,
definitely.
oh, sorry you're dealing with that. That sounds miserable.
Yeah, and it brings up another good question that um that has come up quite a bit as far as biologics and acting as an immunosuppressant for patients with HS. So can you clarify a bit about that? Because I know there's some confusion where for us, we're an overactive immune system. So from my understanding, it kind of brings us back to like what a normal person's immune system would be, not necessarily a suppression. So can you talk a little bit about that?
Yeah, and that's the goal. There's sometimes unintended consequences, and I do definitely run into people who are told by someone that they shouldn't take medications like Humira anymore, and that isn't always the case. So yeah, the goal with these medications is basically to sort of calm down the extra inflammation to get you back to where someone with HS wouldn't be. And the good news is when we look at like thousands of patients with HS or with sorry, on medications like Humira, can't talk, we actually see that the rate of infections is not that much higher than the average population. And again, not something to mess around with. But we also know that not all these medications are created equal. So medications like Humira that you mentioned, or there's one called infliximab that's used a lot. You might have heard the brand name Remicade. Those do work a little more broadly on the immune system. So they're probably a little more likely to lower it in a way you don't mean to. But there's a lot of newer medications, like the most recent one that's been approved for HS is called Cosentyx, and that works on a much smaller part of the immune system. So it really avoids a lot of the overall immune suppression. Our immune system is super complex. You can't think of it as just sort of on, off, up or down. I think of it as like a whole spider web of things. And, we're trying to hit little parts of it without knocking the whole thing down. So there definitely are other options, including if you've had trouble with things like Humira or Remicade. But it's tricky because we have to be understanding that medications have potential side effects, but at the same time, sometimes what we think are side effects are actually just the HS. So it can be really hard.
Yeah, definitely. And I was going to go back to what you had mentioned about cellulitis. And, we know that there are so many physical impacts that happen, even just with a regular flare for us with HS, and they vary so much person to person. So I know it can be sometimes hard to distinguish whether it's cellulitis or just a flare in a new area or that's acting different. So what we've heard, and I wanted to see if you kind of ascribe to this as well, is that if it's acting different than your normal flare, like pay attention. Those
Yeah.
are the things you want to be in tune with your body about. And if there's a question to go ahead and seek care, just because you don't want to get to that point where it becomes cellulitis and then, you're in a sepsis situation.
100%. Yeah. And I love that. As a dermatologist, we talk about things like that with moles too, just like what's normal for you and what's not normal for you. And honestly, as I'm sure you guys are all aware, everyone's HS acts different for them too. So it's important to sort of understand what is normal for you, share that with your provider, and let them know when you feel like something is different.
Yeah, definitely pay attention and kind of be in touch and in tune with your body as much as you can. And then Donna had pointed out that Carmelita had mentioned another myth is that HS is a boil. So can you clarify that? Like we actually refer to them as boil-like abscesses because we know boil is the most commonly used term, but boil is its actual own medical diagnosis. So can you fill us in a little bit on that?
Yeah, it's hard because I am 100% do this because I try to use language people use to me so they understand. So boil, to me, boil is just like an inflamed thing. And I definitely hear what you're saying, Donna, because I think like the word abscess, boil to many people like means infection. And to a lot of people, abscess means infection as well, which is really tricky because we use the word abscess in HS too. So it may just be how it's used, but it's important to know that like if someone's calling it an HS boil, that it doesn't mean it's infected. It just means it sort of looks like a big, angry, swollen thing. So we're trying to come up with better language to describe HS to help people understand.
Yeah, I
That.
just been around my grandmother a long time.
Yes,
And that's what they always called the boil.
exactly.
So that's like, because
Yeah.
when I first got one, when I was like, I was in my senior year and it was in the crack of my rear end, and I was like, what is this? And my grandmother then was like, it's a boil, and I'm like, I've never heard of those
I
things.
know. Yeah, some people don't even know what boils are anymore.
Yeah,
So,
so it was really weird. So
yeah.
like, and then they just started coming on and on, and I can't even explain how many, as they say, surgeries or abscesses I've have gotten
Mhm.
drained or whatever. But this one, like I said, I couldn't, like I said, it has gotten to the point where he wanted to take. I have a really large breast to. I was like a double D to where he wanted to take them all the way down to A cup to because that's how bad they have been with been for this last year.
That sounds so awful.
And then it looks like Nina had a question. Are you seeing more correlation between hormones, insulin resistance, and HS?
Yeah. And the easy answer to that is yes. The hard answer is we don't fully understand it, but we do know that people who have HS are also more likely to have a lot of other conditions, and insulin resistance, diabetes is one of those. And at the same time, it probably goes the other direction, which is that, hormonal imbalances is probably the best way I can put it, insulin resistance. They also cause their own problems in the body, including issues with inflammation and probably make HS worse. And so we actually use a lot of the same medications that you can take for things like PCOS, for things like insulin resistance or diabetes. A lot of those things can help with HS in some people as well. So it is important once you know you have HS to make sure you're really well plugged in with a good primary doc, or PA or NP, whoever you see, who's sort of looking for these other things that sometimes run along with HS, to make sure that you're sort of being well cared for overall, and at the same time addressing some of those other things. And some people really can help their HS get better as well.
And then in that same vein, Stephanie had a question about can you discuss the effect of spironolactone on HS?
Yeah, so spironolactone is a really interesting medication. We use it all the time in dermatology. If you guys don't know, it was originally and still sort of used as a blood pressure medicine, not the best at that, but it turns out that it blocks a lot of the I don't have good words for this, what we call androgens. So the type of hormones in the body that are sometimes referred to as like the male hormones. We all have that. Everyone has androgens and estrogens, but we think that those in some people, hair follicles and HS is sensitive to those, and spironolactone can sort of block how those act in the skin, which can help. So the group of people that a lot of times will be recommended spironolactone are people that like flare with or before their periods, people that have irregular periods, have other signs of like PCOS. But honestly, I will basically use it in any woman just because I think there's probably some component of hormonal trigger, even if you don't feel like it, especially if your HS is flared all the time, you may not realize that. So it's worth a try if it's a good option for you. You know, it's not like the most potent medication. It's not going to cure someone with early stage 3 HS, but it definitely can help in people with milder disease or as sort of like a piece of your treatment, even if you have more severe disease. I use it all the time.
Good
Also
for
helps
everything.
for acne. Yes. Excess hair growth. It's great.
It's funny how something that starts out as like a blood pressure medication has so many other indications that it works for.
It's
It
so
just
weird.
seems like it's
I actually don't know
backwards.
how they figured it out. I should look into the history of it.
Yeah,
So
who
yeah.
decided, let's give this a shot and see how it works out. And then I wanted to ask a question. Donna had mentioned up above, like that surgery should be the last resort. And I see some of this is a shift that seems to be happening. I think surgery is such a big, broadly used term in HS, and there are so many different procedures that I think typically when we mention surgery, people instantly go to like a wide excision surgery.
Yeah.
We're seeing, you know, the trend kind of using both medication and surgical treatment options to kind of help with the HS. And I know that when you have draining tunnels, this is an area that we know is not going to be helped by medication because of just the nature of the sinus tracts and the tunneling. So can you talk a little bit more about like what the different surgical procedure options are and how those are kind of being used in conjunction with medication?
Definitely. I would love to. So we can start with big surgery since you mentioned it. And if you know enough people with HS, you'll know someone who's had their entire axilla armpit cut out. And for some people, it works great and it gives them a lot of relief. But what we see in a lot of people is then they still have HS at the edges, they still have HS in other parts of the body. So what we're learning is that for most people, a big surgery like that alone is not going to be enough. You're going to eventually get things elsewhere. So big surgeries I think of for a couple of groups of people. So I think of it sometimes in people that just aren't getting a lot better with the medications we're trying. But something that you kind of, I think, referred to is that people with a lot of scarring and tunnels, sometimes the medications will calm things down. So maybe they're not inflamed and sore and draining as much, but the tunnels are still there. And the risk of that is that over time, the medication may not work as well and things can flare back up. So sometimes we'll also do bigger surgeries like that to sort of cut out all the areas once they're quieter. And what we also are learning more and more is that being on a medication that's controlling your HS also means you're probably going to heal better from surgery because there's not active HS like within the areas trying to flare up. But there's also lots of smaller options, and something we're using a lot of are more like targeted procedures. And one of the most common ones is called a de-roofing. And what that entails is sort of picking one individual HS spot, whether that's a little nodule, a tunnel, and sort of taking the whole top off. are you guys okay with gross food analogies? Okay, so Wisconsin State Fair is very big into cream puffs, you guys know, right? I think of this as like, instead of just draining, like you may have had where you poke and drain something, this is like taking the whole top off and scooping all of the cream out. And you sort of are left with the little shell of this cream puff. That's the bottom of your HS cyst or tunnel, whatever, that then kind of heals in as a scar. And this is an awesome procedure for like local areas, those spots that just keep coming, even though your medication has helped everything else. And sometimes that's enough to just kind of get rid of that spot. And when you do it that way, instead of sort of cutting, and especially cutting and sewing, it seems a little less likely to come back. So I totally agree. I have patients come to me who've had either bad experiences with surgery, or they've had a big surgery and everything came right back. And then they're often, I mean, I think very rightfully so, scared of more surgery. And sometimes it's just finding the right procedure, or the combination of the right procedure with the right medication to get you to the best place. So tons of options. Yeah.
Yeah. And I've had both of my axilla, cut out via wide excision and secondary intention healing. So healing from the inside out. And I have had amazing results.
Yeah.
And I think, it just speaks to how personal HS is and how one thing works for one. I mean, I've gone on to have like 7 more surgeries in my groin because it seems to be what works for me.
Yep.
So it's crazy. And it felt like, a while ago that it was like, we get so few options. Now we're starting to see so many more treatment options, which is very exciting. But it was like a way that I got to choose to take some control.
Yep.
And as long as you enter into it, knowing that there's a chance that it could return, like you have to set realistic expectations as a patient for, I think, everything we encounter. And that's a really important thing for us as patients, is to make sure that our expectations are realistic. There is nothing that's going to come and take all of it away, as much as we wish there was.
Maybe someday.
Yeah. So just make sure
yet.
that we have a good understanding of what can be accomplished. And, just because that also reflects on how well we think we're going to heal, or how well a treatment option will work as
100%.
well. I think that mind over matter thing truly plays a role.
Yeah.
So yeah, it's fascinating. There's so many different options, and it's so amazing to see how many drugs are in the pipeline and going through clinical trials right now, because it's an amazing time for HS. So are there anybody else have any other questions? I mean, I think you hit all of the misconceptions. I mean, it's the interesting part too that I wanted to point out was about men versus women. And the fact that in like Southeast Asia, that more men are actually impacted than women.
I did not know that. That's fascinating.
Yeah. And I'm so curious.
When I think about my own patients, though, I could definitely buy that being true.
Yeah.
Fascinating.
And does it have to do with society? Does it have to do with culture? I'm fascinated by it.
Oh, I would love to know the answers to a lot of these questions.
Yes.
Just population differences, racial differences in different areas of the world. I think there's so much we don't understand that I hope we'll learn more and more of over time.
Yes. I know. That's why it's also exciting, because we're like, getting a chance now to really get time and energy and money into, our disease. So I think that, I know, unfortunately, it does all revolve around that. So,
and the last thing I was going to say is I love talks like this, because it's always a bit sobering. I feel like when I work so much with other people that see HS all the time, who know about HS, that anytime I meet a patient who's still hearing these things, it blows my mind. I'm like, there's no way people are still being told these things, and they are. And so as much as you guys feel comfortable talking about your own experiences, it is so, so important in helping other people understand too, and helping your doctors understand, because I still run into so many other people who work at an academic medical center who have so little understanding, and it's really important.
Yes, and you'll find, the more that you talk about your own HS journey with other people, the more people will come out and tell you about their HS, or they know somebody who has HS, or I mean, truly, the chances are that every single person here, Donna, you're excluded because you know all of us. But every single person here knows one person with HS who is most likely just hiding it. So the more we can talk about our HS, the more of a chance we have to get all of these people seen and recognized and validated and to diagnosis and treatment. So
Yeah.
it's a very, very important thing for us all to speak out about if you're comfortable, because not everyone is there yet, and I completely respect that.
100%.
So we'll talk about it on your behalf if you're not comfortable yet.
Exactly.
So, Dr. Roth, thank you so much. It was
Of
so good,
course.
and hearing all of this information it never gets old, no matter how many times you hear it or think you already know. It's always a good refresher. So this will be posted on our YouTube channel, and then we will also send the links to everybody else in the HS pack so that they can also link it on their pages as well, so that anybody who missed it has a chance to watch it afterwards.
Awesome. Well, thank you so much for the invitation. It's always fun, and I also love talking about HS.
Yes, me too. I could talk about it for days. I know Donna could too. We do. So
okay, I'm gonna
All
attempt to figure out how to stop sharing and to stop recording, and then
okay,
we can
it'll end
get
when
this
we're
little last bit out of here.
yeah, perfect.
Wait, am
All
I
right,
still
thank
recording?
you
No, I'm just
guys.
gonna end the meeting.
Yeah, perfect. Thanks,
Bye.
everyone.